Hello and welcome to another TLDR Explains video. In this one we're going to confront a controversial and probably slightly uncomfortable question. Whether it's worth crippling the economy to save lives, or to put it a different way, asking what a life is worth. This might sound heartless, but it's a question worth asking, especially if the government is spending too much on a policy that only saves so many lives today, if it won't be able to afford to make policies that save lives in the future. So in this video we're going to apply it to the coronavirus. How much economic damage is it worth to save lives today? This is a controversial topic for sure, just like the ones that we include in our opinionated series. Last year we asked you what you thought about a second referendum, foreign aid, burqa bans and weed legislation. For this series we want to know your thoughts on universal basic income, the cost of university, nuclear power and whether the UK should adopt a written constitution. We have the survey up now, it's linked down below, so tell us what you think and have your views featured in the new series. Also, everyone who completes the survey will get entered into an instant win competition, where everyone wins something, with prizes ranging from discounts in our merch store, to vouchers, to even free badges. So fill out the survey and get your prize now. So, how much money is too much money to spend on saving lives? Most politicians don't like to talk in these terms, because they're worried that doing so will make them sound like psychopathic social Darwinists, which is why Rishi Sunak likes saying that the government will do whatever it takes, and Matt Hancock said on Friday that money is no object. But there are some politicians who haven't been quite so careful with their words. Yep, you guessed it, we're talking about Donald Trump. Just to give you a couple of quotes to emphasise this. At the White House briefing on Monday 23rd of March, he said, because of the magnitude of our economy, we can't turn that off and think it's going to be wonderful. There'll be tremendous death from that, probably more death than anything we're talking about with respect to the virus. The same day, he put out a tweet saying that the cure can't be worse than the problem itself. And then the day after that, at a Fox News event, he said, look, you're going to lose a number of people to the flu, but you're going to lose more people by putting the country into a massive recession or depression. You're going to lose people. You're going to have suicides by the thousands. You're going to have all sorts of things happen. Now, Trump is certainly wrong about some of this. While there is a good chance that suicide rates will increase in the coming lockdown-triggered recession, it's incredibly unlikely that they go up so high that more people die of suicide than would have died of the coronavirus. The US suicide rate is currently at about 14 per 100,000 people per year, or about 0.014%. Given the coronavirus death rate is about 1%, if we assume that about 50% of the US would catch it over the year that nothing's done to slow it down, the suicide rate would have to increase by about 30 times for the same number of people to die. However, when Matt Hancock says that money is no object, he's also wrong. Because even if you care about human life, at a certain point, the money can be better spent saving a human life elsewhere. They've both got a point though. Trump's saying that unfortunately you have to put some sort of number on life, and Hancock saying that that number should be very high, which leads us to an interesting question. What does the government actually think a life is worth? To answer that question, we need two things. We need the lives, or more specifically the life years the government thinks the coronavirus policy will save, and we need the expected economic losses. Before we get into the maths, quick disclaimer, both of these things are very difficult to measure, and we're a YouTube channel, not a think tank, so our calculations won't be hyper precise. So to start with, the relevant unit here is life years, not just lives. The way we're going to measure this is take the number of lives that would be lost with no lockdown and then subtract the number of lives lost with lockdown. Let's start with the number of lives that will be lost under lockdown. According to the government's official predictions made in mid-March by Dr. Neil Ferguson at Imperial College London, 510,000 people would die if the government did absolutely nothing, and 250,000 would die if it successfully executed its mitigation policy, which is basically the herd immunity policy we discussed in an earlier video, and then there'll be 20,000 deaths if the UK went into lockdown. To figure out how many life years those 20,000 deaths equate to, we need to know, on average, how many years these people would have lived had they not got the coronavirus. To do this, we're going to take data from Italy about the demographic spread of the coronavirus fatalities, and then transpose that onto the UK population. So, starting with the Italian data from March, the breakdown looks like this, with the majority of deaths being in older age groups, with 35.3% of deaths being in the 70 to 79 category, and 40.2% of deaths being in the 80 to 89 age group. To adjust to the UK population, you take those values there, divide the percentage of the total Italian population that each age group accounts for, and then multiply by the percentage of the total British population that each age group accounts for. After doing that, you'll get something like this. To estimate the number of life years, you need to look at the UK's life tables. These tell us how many more years you can expect to live if you're in each age group. For example, if you made it past 90, you can expect to live about 3 more years. If you're in the 60 to 69 range, you can expect to live 20 more years. Once you've weighted the data for the fact that 3/4 of the deaths in Italy were male, you end up with the following values. Finally, to get the average number of life years, you just need to multiply each percentage with their expected life years, and you get the total of 11.3 expected life years. This means that your average coronavirus patient is dying about 11 years before they naturally would. Now, this figure is definitely too high, and it doesn't account for underlying conditions. In fact, according to the data, 98.6% of deaths had one or more underlying conditions, the most common being high blood pressure with 75%. Now, while this number sounds insanely high, you're probably underestimating how many people have underlying conditions in the normal population. About 10% of over 40s have diabetes, over 20% of over 60s have chronic kidney failure, and 65% of over 60s have high blood pressure. Nevertheless, the real number is going to be somewhat less than 11 years, and probably nearer 5. This is a bit of a guesstimation, and we're sorry for that fact, but accounting for underlying conditions required data for life expectancies that simply wasn't available for us. So we're going to assume an average of 5 life years lost per fatality, and with 20,000 fatalities, you would get about 100,000 life years lost under the lockdown. We now need the number of years that would be lost if the UK didn't go into lockdown. Now, while the original Imperial study estimated that 250,000 people would die if the government continued its mitigation strategy, this was under the assumption that the mitigation strategy could keep the inflow of patients to the NHS steady enough that the NHS wouldn't be overwhelmed. Given that the government had to drop their mitigation strategy precisely because the NHS was being overwhelmed, the real number is going to be somewhat higher, though obviously lower than the upper limit of 510,000 people, which the Imperial study predicted if the government did absolutely nothing. We're going to split the difference and give the figure of 380,000 people, which is a halfway between the 250 and 510. Because the NHS is overwhelmed in this imaginary counterfactual, people who would have survived if they'd had access to NHS resources would die, which means that the average life years lost would be higher. Basically, people who would have survived if there was a spare ventilator around would die in this scenario. And these people would typically be healthier and could expect more life years than people dying on ventilators at the moment. This brings the average number of expected life years lost back up again. Again, this is basically impossible to measure, so we'll go for a conservative estimate of 7 life years lost. So to find the number of life years lost in this mitigation counterfactual, we just multiplied the number of lives lost by the average life years, which comes to 2.66 million life years lost. Finally, to figure out how many life years the government expects the lockdown policy to save, we simply subtract the life years lost under the lockdown, 100,000, by the number of life years that would be lost without a lockdown, 2.66 million. Doing this comes to about 2.5 million life years. So now let's take a look at the money. To figure out the economic impact, once again, we're going to need to look at the economic loss of the lockdown policy, and the economic loss that would have occurred anyway. Let's start by looking at the economic loss of the lockdown policy. Luckily, we don't have to do any guesstimating here, because Jacob Nell, the UK's chief economist, has done it for us. According to him, we can expect a 5.1% GDP loss in 2020, and then a 5.6% rebound in 2021, assuming that everything calms down by then. If we compare that to the Bank of England's forecasts of a 1.4% growth in 2020, followed by a 1.6% growth in 2021, that's basically a GDP loss of 3%, or about £66 billion. Just a quick note on government borrowing. The big number being thrown around in the media at the moment is £350 billion. But £330 billion of that is just loan guarantees, which the government only has to pay if the loans are defaulted on. Given the average default rate for a small business that takes out these loans has historically been around 1%, the government won't actually end up paying most of this. In fact, the biggest cost to the taxpayer will be the government's employee retention scheme, which allows certain employers to claim 80% of their wages up to £2,500 per month, which the IFS estimates at £10 billion per 3 months per 10% of the workforce that takes advantage of it. Anyway, the long and short of it is that according to the IFS, the government has had to borrow an additional £110 billion more than we expected. Most of this is in cash payments to the temporarily unemployed, though it's not the most helpful for measuring the hit to the economy. The real question is whether or not the taxation required to pay back this money will disrupt the UK's economic future, and no one really knows that. So we're going to have to stick with Jacob Nell's figures. So, £66 billion is the amount of money lost in the lockdown. So, how much would have been lost under the government's original mitigation strategy? Well, it's also pretty hard to calculate for obvious reasons. But we can say for absolute certainty that there would have been an economic downturn anyway. Sweden, which isn't locking down, expects GDP to drop by 4% in 2020, and then grow by 3.5% in 2021, according to its finance ministry, which actually leaves it worse off than the UK at the end of 2021. As a conservative estimate, we're going to say that the economic losses will be half as bad, so £33 billion. This means that the lockdown policy is only costing the UK £33 billion, compared to if the UK didn't lock down. This should be somewhat surprising, because even if the government didn't enforce a lockdown, people would most likely voluntarily stay home to avoid contracting the virus. So, using our terribly uninformed guesses, we estimate that the lockdown policy will cost the UK £33 billion and save about 2.5 million life years. This puts the cost to each life year at about £13,200. Is that worth it? Well, the National Institute for Healthcare Excellence estimates the value of a life year to be £30,000, but will pay up to £60,000 per year of end-of-life treatments. The Department for Health and Social Care and the Treasury's Green Book also use the £60,000 per life year figure, so £30,000 is actually looking like a bit of a bargain. Even if you rounded up all of our guesstimates, you'd be hard pushed to get it to the £60,000 per year number. So it looks like it's fair to say that the coronavirus policy is indeed worth it. What do you think though? Do you think the government is spending too much to save too few lives? Or do you agree with the government's policies? Be sure to let us know your thoughts in the comments, and of course you can get involved in the conversation over on Discord. For more updates on the coronavirus crisis as it plays out, and to be notified every time we release a video, be sure to subscribe and hit the bell icon. You can also find more from us across all social networks, simply by searching for TLDR News. Special thanks to our Patreon backers who make videos like this one possible.